Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Asia Best. She's a healthcare executive and patient advocate. Today's Kevin MD article is How Early Chronic Kidney Disease Diagnosis Can Save Lives, a Transplant Survivor's Journey. Asia, welcome to the show.
Thank you, Kevin. Thank you so much.
All right, so let's briefly share your story and what led you to write your Kevin MD article.
Yeah, absolutely. So currently healthcare strategy consultant, really a kidney patient advocate with a deep focus on equitable care and digital innovation. So my work spans through technical program management, experience in value-based care, really particularly kidney disease, where I'm trying to help scale solutions that improve patient access and provider efficiency. I'm also a transplant recipient, which is great. Very lucky to have had that experience. And through that lived experience, that's really what's shaped my advocacy work. I've worked with organizations like the National Kidney Foundation, where I currently serve on the Patient Advocacy Committee. I work with American Kidney Fund and other organizations to really advance education and early detection. And I use platforms like Kevin MD and other panel appearances to share stories that empower patients and really try to push for system level change. I was diagnosed in 2018 with IgAN through some scary post pregnancy tests. I received a notification that I had proteinuria or
Yep.
elevated protein in your urine. It's not filtering correctly. Biopsy indicated IgAN. After that, really kind of no real guidance or knowledge of how serious the condition is or what to do next. Crashed onto dialysis, which crashing, for people who don't know, it happens to a significant amount of kidney disease patients. It is really going into dialysis without knowing that it's needed and without a proper plan in place, modality selection, things like that. And then after being on dialysis for 2 years, I really took action, advocated for myself, and found a living non-related donor, which is incredible. I was on the transplant list, but received a living donor, which is preferred. They
hmm
usually last longer for people who don't know. And then I received that surgery in November 2020. So November will be 5 years. I'm super grateful, but we still have a lot of work to do. So that's what really drives my advocacy work and what led me to kind of share my story and help other patients.
All right. So in your story, you highlighted some systemic failures regarding that whole transplant experience. So tell us about that story.
Yeah, absolutely. So when I was first diagnosed, it was post biopsy, but the early warning signs came through an OBGYN, right?
Mhm.
So I'm learning about a disease that affects another organ through a provider where that's not necessarily under their umbrella. And that wasn't necessarily my OBGYN's primary concern
Yeah.
because I was with child, right? So they're
Yeah.
focused on delivering the baby safely if I chose to continue with the pregnancy, which they advised me not to. Continued with the pregnancy, have a healthy 9-year-old. But I think what was the glaring gap for me was the coordination or lack thereof between
Yeah.
an OBGYN and a nephrologist and the complications that come with the pregnant person realizing after the fact that they have kidney disease is probably really hard to navigate. And there was no real coordination effort there. It was really a linear approach I saw through the providers, and it wasn't really treated as urgently. I know our healthcare system is limited, but I didn't really know what to do next or how extreme my circumstances were and how bad it is for your health. It was it was also very terrifying. The communication didn't really seem patient accessible.
Yeah.
You have to use a lot of Google to understand these terms that the clinicians are using because it seemed very, clinician language heavy.
Now, did you have also another primary care physician who could oversee this, or was it just the OB that led you to see the nephrologist?
Yeah, it was the OB that led me to see the nephrologist. There was no PCP incorporated. And I think if I wanted that type of oversight, like that home base of a PCP managing me holistically, I probably would have had to do that on my own because it wasn't something that was initiated by either provider at the time.
Mm. So Tell us about your article in terms of the things that you advocate for to obviously prevent a situation happening in others.
Yeah. So the article was really personal. What inspired me was really like how long it took me to get diagnosed, the fact that I did crash into dialysis and that I didn't understand how serious it was until it was too late. It was very terrifying, traumatizing experience.
Yeah,
And I really wanted to bridge my story with the broader clinician gaps that I saw personally, and then also later on professionally, because I worked in the kidney care space for a value-based care company. And so I was seeing the gaps in the kidney care systems.
sure.
And it wasn't really about blaming providers. It was about urging early screenings, clear communication, real coordination. And I felt it was a way to start a conversation that clinicians could actually hear from a patient that actually experienced it.
Now, what would you have liked to see differently, I guess, in your ideal situation, in a perfect world? What would you have liked to see happen?
I think I would have liked to know how extreme the circumstances were in a prognosis, because at the time I was really just getting disseminated information.
Okay.
Hey, you have chronic kidney disease and you may need dialysis. Okay, don't know what those terms are.
Hmm.
What is the prognosis? What are my options? What is dialysis? What are the like some type of explanation that would give me a holistic view of the options and then also how that affects your life. Hey, we need to potentially try to slow your disease progression so that you can get things in order prior to going on dialysis. Was dialysis always the way that I needed to go, or was there an opportunity for me to slow disease progression to the point where I wouldn't need RRT? What does CKD3 mean in terms of the whole picture going to ESRD? How fast is my disease declining, or how quickly is my disease progressing? So just a bigger picture, more understanding, options, communication about the prognosis, and really how it impacts your everyday life.
Now, give us a sense of the type of practice settings that you see. Do you live in a rural area? Was it in a city with access to academic medical centers? So just give us a sense of the type of practice settings that you saw.
Sure, yeah. I was living in New York City at the time, so huge practices. It was, again, really great providers. I think the gap was just the communication. So I had a lot of access, right? I was very fortunate. I didn't live in a rural setting. My daughter was born at Mount Sinai, so 6 weeks after she was born, I was back at that hospital getting a biopsy, right,
Yeah,
in
yeah,
between breastfeeding. So even with that incredible amount of access, still really didn't grasp the full picture, what I needed to do, take
yeah.
action immediately. And really, I think it was an unintentional disconnect between me and the providers.
So it sounded like you still, even though you saw the nephrologist, they spoke to you in terminology that you still had to research yourself in Google.
Yes, absolutely. And maybe a lesser informed patient wouldn't do those things. Or someone who's not interested in learning, they're kind of like, oh, if something was serious, they would do something. That's kind of the approach that we take. No news is good news. So being kind of scared and terrified, especially being a new mom, I was like, I need to be way more proactive and understand what these things actually mean.
Now, was there anyone who could guide you in terms of this journey? Like you said, there's no playbook and you had to do a lot of the research yourself. There was no one to guide you from the healthcare setting through this diagnosis.
No, not really. Everything was very reactive. My OB was focused on how are you doing, managing, making sure that I don't have postpartum, managing all of these things with motherhood. I'm working, all of the holistic approach for the mother was
Hmm.
not focused on kidney disease. And there's so many resources out there, some of which I participate in. There's an NKF peers program where it's working with peers that have been in the situation and helping guide a newer patient through this and navigate the systems. There's American Kidney Fund Coach. That's also something I'm a part of. So there are resources to kind of alleviate the providers so that they can,
Sure.
work on their visits and kind of help in the more patient centric, and the patient centricity can lean on these nonprofit organizations.
In your article, you talk about some solutions that could break down some of these silos. So talk about some of the paths forward.
Yeah, I think it's patient accessible language, better care coordination, really listening to the patients, maybe we're not clinicians, but oftentimes we can sense something wrong with our bodies, helping the patient participate in their care, but leveraging, machine learning. Technology has come so far. So really taking technology and using it in a way that we can detect patients early if they have kidney disease, really trying to leverage risk stratification models, machine learning to really target people that may be at risk for kidney disease, and especially in our underserved communities.
So what are some of the ways that we could screen for kidney disease?
I mean, not to be a clinician, and I'll leave it to you all, but I mean, a simple, UACR, right? Urine tests like in proteinuria, early sign of potential kidney disease. I'm not sure of the stats. I rely on my personal nephrologist's understanding, but he's like, 8 times out of 10, it's going to be something wrong with kidney disease, whether it's reversible or not. That's a flag, right? So I think that's probably your basest way to move forward. And then looking at patients and listening to them, because sometimes it's not textbook. Sometimes symptoms are atypical. So, really listening to them and, relying on our providers to kind of use their expertise and paint that picture. But yeah, patient centricity.
Now, what about other patients who may find themselves in your situation? Perhaps they're pregnant, they have protein in the urine. What kind of advice do you have for patients in order to better advocate for themselves?
Ask questions early and often, participate in your care, lean on your providers. No question is a dumb question. Communicate your symptoms thoroughly, really try to understand what's being presented to you. And if you don't, dive deep, and follow up. And when I say lean on your providers, they are the experts. So sometimes there may be a gap in that. It's like lean on them, they'll help you fill in that understanding.
Yeah.
Because they have the information. So really advocating for yourself in those spaces and, doing your checkups, you have to, and following your provider instructions, because as my mom's always said, you're either going to take vitamins or you're going to take medication. So you have the power to be as preventative as possible. Hydrate and sunscreen is what I live by as well. So we have to be good patients too.
Now, what about the role of second opinions? Did you run your story by other nephrologists or clinicians before ultimately going through a kidney transplant? What's the role of second opinions from your viewpoint as a patient advocate?
Sure. I never really had any second opinions for myself personally, just because I would always do the research up front. Who is the best for this? For instance, when I was picking a transplant center, I looked at who does the most living transplants successfully in San Diego. So I picked Sharp because they do the most living, versus Scripps does the most. If you're on a transplant list, people go there for deceased donors. So second opinions didn't really play that much within me, because I'm always looking for the best up front. However, I do think that it's important to get a second opinion, especially if you're not feeling heard or you're not completely understanding and you don't necessarily vibe with that clinician. It's no offense to the clinician or anything like that. It may just not be a connection and you don't feel comfortable. So I think it's important to find a clinician, whether it's the first one or, multiple visits that you have to go to, where you can feel comfortable advocating for yourself, asking questions, and feel like you're getting answers in a way that you understand.
So when you were researching transplant programs, you mentioned that you did research in terms of which programs did the most living donors and whatnot. How did you know to do that? Were there like patient forums that told you to search with those parameters? So tell us a little bit about that search process.
Yeah, I knew that I wanted a living donor. And at the time, my brother was a match and we were coordinating all of our care across the country. He was living in Charleston, I was living in New York. But I knew I wanted to end up back in San Diego, coordinated everything with my work to move there. And I needed the support of my family back home in San Diego. So I knew that I was going to do a living. So I was like, okay, which one does the most living? Now, ultimately, my brother as my donor didn't work out. It actually was a terrible story. I won't bore you with the details, but my transplant, my original that was scheduled, was declined the night before because of some clinical oversights. And I'm sure there's some complexity to coordinating care across country, labs and things like that. So because of that, I went on to dialysis 3 weeks after that intended surgery. So at that point, I was looking at maybe I should list with another center because I may just have to go onto a list and get a deceased donor. I didn't know anything about that. I just knew I wanted the best of the best care because I had, after getting that diagnosis and having it be such a surprise, I became hypervigilant and really scared of everything. And so I was always looking for what's the best care. So I figured, why not look at, okay, what's the best transplant center? How do I know that? Well, what does the best living donor transplants? Because that's what I'm intending.
We're talking to Asia Best. She's a healthcare executive and patient advocate. Today's Kevin MD article is How Early Chronic Kidney Disease Diagnosis Can Save Lives, a Transplant Survivor's Journey. Asia, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Yeah, absolutely. Early detection is possible. My story is preventable, and early detection, early screenings can save lives, preserve quality of life for individuals. My story, I think, is a clear example of what can happen when early warning signs are missed or not caught early enough. And we can see what's also possible with early intervention, right? Like patients are not, passive recipients of care or an individual just to disseminate information to. They should be considered partners in the care. And so when patients are empowered to ask questions and trust their instincts and lean on their providers, they become active participants in protecting their own health, which could lead to better clinical outcomes, medication adherence, et cetera. And when providers take the time to educate and engage with their patients, it kind of creates this foundation of earlier diagnoses and stronger outcomes, and potentially fewer people crashing onto dialysis or avoiding RRT in general. And I feel with that and the power of a story, we can change the trajectory of CKD, one informed conversation at a time, in a PCP visit, nephrology visit, or sometimes another type of provider's visit. Just any provider can catch CKD.
Asia, thank you so much for sharing your story, time, and insight, and thanks again for coming on the show.
Thank you so much.